Hello everyone, myself Dr. Syed Abrar. Today we will see the cubital fossa under the different headings starting from features or introduction, then boundaries, roof, floor, contents, and lastly is the applied anatomy. It may come as a short note in the university exam. And what is the cubital fossa? This is the triangular hollow situated on the front of the elbow. Then there are different boundaries. It has lateral boundary, medial boundary, base, and the apex. This is the lateral boundary. Laterally, it is formed by the medial border. This one is the medial border of the brachioradialis. Medially, it is formed by the lateral border of the pronator teres. Base. This one is the base which is directed upward and is represented by the imaginary line passing on the front of the two epicondyles of the humerus. This one is the apex which is directed downward and is formed by the area where brachioradialis crosses the pronator teres muscle. These are the boundaries. Then the roof. Roof is formed by skin superficial fascia. Superficial fascia containing the median cubital vein. This one is the medial cubital vein joining the cephalic vein with the basilic vein. Then the lateral cutaneous nerve of the forearm which is along the side of the cephalic vein. Then the medial cutaneous nerve of the forearm which is along side of the basilic vein. Then the deep fascia and the bicipital aponeurosis. These structure form the roof of the cubital fossa. Then the floor. Floor is formed by the two muscles. First is the brachialis and the supinator muscle. This one is the supinator muscle. These two muscles form the floor of the cubital fossa. Then the contents. Contents are remembered by the mnemonic MBBR. This cubital fossa. Actually, this is the narrow. The contents are described by retracting the boundaries. It is remembered by the mnemonic MBBR from medial to lateral side. This is the medial side. This one is the lateral side. M means median nerve, brachial artery, biceps tendon, and the radial nerve. This median nerve supplies the it gives branches and supplies the muscles like flexor carpi radialis, flexor digitorum superficialis, and palmaris longus, and leaves the fossa by passing between two heads of the pronator teres muscle. This brachial artery, the termination of the brachial artery and beginning of ulnar and radial artery are within the cubital fossa. This then the biceps tendon or bicep brachii tendon. Then the lastly or lateral most is the radial nerve. This is just medial to the lateral epicondyle of the humerus, which supplies the three flanking muscles below the lateral epicondyle. It is remembered by the mnemonic MBBR, that is median nerve, brachial artery, biceps tendon, radial nerve. This is the contents of the cubital fossa seen on a cross-sectional view. This is from medial to lateral side. This is the median nerve, branches of brachial artery, that is the ulnar and the radial artery. This radial artery is smaller and more superficial than the ulnar artery. And the tendon of biceps brachii and the radial nerve. Floor is formed by this brachialis and the supinator muscle. And lastly is the applied anatomy. This median cubital vein is the vein of choice for intravenous injection, and is the most common vein for collection of the blood sample. Then this bicipital aponeurosis prevent the accidental puncture of the brachial artery. Blood pressure. The blood pressure is universally recorded by auscultating the brachial artery in front of the elbow in the cubital fossa. Then the fracture. The knowledge of the cubital fossa is helpful while dealing with the fractures around the elbow like supracondylar fracture just above the elbow, that is the supracondylar fracture of the elbow. There may be occlusion of the brachial artery within the cubital fossa which causes ischemic changes in the forearm and the hand. There may be injury to the median nerve in the cubital fossa. Then we will summarize the cubital fossa on this slide. These are the boundaries. This is the lateral boundary which is formed by the medial border of brachioradialis. This is the medial boundary which is formed by the lateral border of the pronator arteries. This is the base which is directed upward, formed by the imaginary transverse line joining the two epicondyles of the humerus. This is the apex which is directed downward, formed by the area where medial and lateral boundary meets. Then the roof is formed by skin superficial fascia containing median cubital vein, lateral cutaneous nerve of the forearm, medial cutaneous nerve of the forearm, bicipital aponeurosis. Then the floor is formed by two muscles, brachialis, and this one is the supinator. This muscle is the supinator. These two muscles form the floor of the cubital fossa. Then the contents are remembered by the mnemonic MBVR from medial to lateral side. This is the median nerve. This one is the brachial artery. This is the tendon of bicep. This one is the radial nerve. Then this is the cross-sectional view of the contents. This one is the median nerve. This is the ulnar artery. This one is the radial artery. This radial artery is smaller and more superficial than the ulnar artery. This is the tendon of bicep. This one is the radial nerve, and this forms the supinator and brachialis forms the floor of the cubital fossa. Then in applied anatomy, there are the fracture. Knowledge of cubital fossa may help in dealing with the supracondylar fracture. Median cubital vein is the vein of the choice for intravenous injection and is most common vein for collection of the blood sample. The blood pressure is universally recorded by auscultating the brachial artery in front of the elbow. Thank you. Thanks for watching.